Okay. We're gonna be working on, so have y'all done anything at all yet with the PEDS calculations?
We've done some, but I think you can start from the beginning so everybody
Okay.
can know your way.
Okay. All right, so we're gonna start on chapter, it's gonna be page 308, excuse me, 303, Lord, 603. And what we're gonna do is just start, what I like to do when I'm doing PEDS is just start at the beginning with the simple stuff and then just work on down to the harder stuff, okay? And really, to be honest, as we do this, y'all gonna realize it's not hard at all. It's just a matter of just knowing what to do, okay? So, all right, I'm gonna share my whiteboard. Maybe, there we go. Okay. All right, so, all right. So the very first thing that you got to know how to do is just converting from pounds to kilograms and vice versa. Okay. So we're just going to do one of those. I think y'all should probably all know how to do that already, but we're just going to go over that real quick because that's going to be always one of the first things that you're going to have to make sure that you do. Okay. So we're looking at page 604. The first, wait. Yeah. Okay, yeah. So 604, we're just going to look at that first example that they do. And they just have want us to convert the child's weight of 30 pounds to kilograms. Okay. So one of the easiest ways, or one of the things that you really need to commit to memory, y'all, is that when you're doing pounds to kilograms and kilograms to pounds, okay? Because this is something that you're going to do a lot. And so just getting in your mind it right, like, do I multiply or do I divide? Okay, so when you're going from pounds to kilograms and then kilograms to pounds. All right. The way that I make this make sense in my head, and it doesn't make sense to everybody, but it makes sense to me, right? So what's our conversion factor? We have 1 kilogram equals 2.2 pounds. So the way that I remember, do I need to divide or multiply? If I'm going from kilograms to pounds, I'm going to multiply by 2.2. I'm going from pounds to kilograms, I'm going to divide by 2.2. And the way that I remember this is that I would rather tell somebody my weight in kilograms than pounds, okay? Because if I tell somebody my weight in kilograms, it's going to look like I weigh less, even though it's the same, right? So if I have 30 pounds, and I want to convert it to kilograms, I'm going to divide by 2.2. So that's going to give me 13.63. So with when you're doing pediatric calculations, when you get the weight, okay, you're going to round at this point to the 10th place, okay? And then that is what you're going to use to work the rest of your problems. So if our patient is 13.63, what would be our final answer in if we round to the 10ths?
13.6.
13.6. Okay. So anytime we're going from pounds to kilograms, we're going to divide by 2.2 because we're going to a smaller number. Okay. We're going from kilograms to pounds because we're going to a larger number. We're going to multiply by 2.2. Okay. So getting this just kind of sealed in your brain. At any time I'm going from these pounds to kilograms, I'm going to divide by 2.2. It's going to make your life a lot easier, okay? Because any medication order that is based on weight, it's going to be based in kilograms, okay? So just getting that down that, hey, if I got to convert to kilograms, I got to divide by 2.2, okay? And then if I have to go back from kilograms to pounds, I'm going to multiply, okay, 2.2. All right, so I'm going to do another, I'm just going to write one up here and I want everybody to do it and put your answer in the chat for me. Okay, so let's do 120 pounds to kilograms. Okay, this is going to be number one. And then let's do 25 kilograms to pounds. All right, so, and just change your chat straight to me, y'all, so it'll just come to me. And then we'll work them together.
Shalom. Ah,
Mute your thing, Ayanika.
All right, what's the odds of those two answers being not close? I just plugged them in. I was like, wait a second, that wasn't even done on purpose. Okay, so if we're looking at these, so remember, if I'm going from pounds to kilograms, because kilograms is going to be a smaller number, then I need to divide by 2.2, okay? And that's going to give me 54.54. So when I round, what is that going to give me?
54.5.
54.5. All right, everybody see that? How we got that? Okay. Now, when I'm going from kilograms to pounds, because pounds is going to be a bigger number, I got to multiply times 2.2. Sorry. Cat's trying to step on the computer. She would have, Lord, she done pulled up something anyway. I don't know how to make that go away. Oh, Lord. No, I think she's just trying to get my food, but I don't think I'm done with it. Can you put this in the microwave so she can not bother me? Thank you, I appreciate it. All right, so if I'm multiplying 2.2 times 25, I'm gonna get 55. Okay, does everybody see that? So any questions on converting from pounds to kilograms and kilograms to pounds? All right, now let's go to page. There's plenty of, on page 609, y'all, there's plenty of practice for these conversions, okay? All right, so let's go to page 611, okay? So what we're going to talk about on page 611 is we're going to start looking at safe dose ranges, okay, and what that means, okay? So I don't know how to make this go away. All right, so when we look at page 611, we're going to look at example 1, okay? And on example 1, it tells us that we have an order, okay? And y'all know I like to pull out all my information, right? Gonna look at my question, I'm gonna pull out the information that I need, then I don't have to keep going back to that question, okay? So it says we have an order for Narcan, 1.2 milligrams, IV stat, and our child weighs 12 kilograms. And it says, according to the reference book, the recommended dose or the safe dose range for this child weighing less than 20 kilograms is, so this is the safe range, 0.1 milligrams per kilogram per dose. Okay, so what they're asking us is well, they ain't asking us nothing. Hold on a second. Well, all right. All right, so what they're asking us, is this safe? Is this dose safe? Okay. So the first thing I always have to do is I have to see, is my weight in kilograms? Is my weight in kilograms? Yes. So do I need to do anything to it? No. Okay. Then what I'm going to do is actually, so what they're asking us is this problem, is it safe? Okay. So since my weight is already in kilograms, what I have to do is the book, the reference is saying for this drug that 0.1 milligrams per kilogram per dose is safe for a patient weighing less than 20 kilograms. Okay. Is our patient less than 20 kilograms? Yes. Okay. Now, what we have to do next is that we have our weight in kilograms. Now I have to multiply the patient's weight times this amount that they say is safe. Okay. So if I multiply 0.1 times 12, I'm going to get 1.2. So it tells us that for every kilogram of our patient, 0.1 milligram is going to be safe. Okay. So when I do this, it's telling me I have 1.2 milligrams per dose is what's safe for this patient. Okay. What is my order? Now I have to look at my order is 1.2. Does it match with this? It does, okay? These equal the same thing, right? 1.2 milligrams. So this is safe. Now, if the dosage was less than this or greater than this, it would not be safe. Okay? So when they only give you one number like this, where it says 0.1 milligram per kilogram, if the dosage is not exactly what it is when you multiply by the kilograms, then it is not safe. Does that make sense? We're going to do some more, okay? And it's going to start making more sense. All right. So this, what you're doing right here, y'all, all this is telling you, not all that is telling you because it's important, is this a safe dose to give to your patient or not? Okay. Then on the exams, okay, whenever you get your exams that's got your pediatric questions on there, you're going to have the pediatric scenario and you're going to have 4 questions. The first question is going to ask you, what is the weight in kilograms? Okay, which we did right here. Then it's going to ask you for the safe range, okay, which our safe range is 1.2 milligrams per dose. Then it's going to ask you, is it safe? Okay, this one is, okay. And then it's going to ask you, how much would you give? Okay. So each of your PEDS questions is going to have 4 different things that you got to figure out. Okay. So on this one, it tells us that the order is 1.2. Our available dose well, I don't even see what they give us to do. So give me 1 second. Oh, here it is on the next page. Sorry. All right. So our order is 1.2. Our available is 0.4 milligrams per milliliter. So once you determine that this is safe, then you would have to determine how many milliliters would you give your patient, and how would you figure that out? What formula would you use? Anybody?
Dose over half.
There you go. So you're going to do your dose over half times vehicle. Okay. So what's our dose? Our dose is 1.2. We have 0.4 per meal. Okay. So I'm going to do your math. And you would give 3 milliliters. All right. So in order to get how much you're going to give, you got to make sure it's safe first. Okay. So let me ask you this. On the test, if this dose is not safe, okay, let's say when we did the math, it was less than this, and you put no right here. What are you going to put for the answer for this one?
0. You don't give
0.
nothing.
Okay, you're either going to put nothing, I wouldn't give it, I'm not giving it because it's not safe, 0 and call the doctor. You can't just give me the 3 meals, because what this looks like, if you tell me it's not safe, but then you tell me you're going to give 3 meals, what you're telling me is you're giving 3 meals even though it's not safe. Okay, so just be mindful of that on the exam. Okay, if it's not safe, then you're not going to give anything. Okay, but you can't leave it blank. Okay, and we don't want you, because a lot of times the students will say, well, I just thought y'all wanted us to work it out. No, we want you to answer. Okay, we want you to know that, okay, if it's not safe, that you wouldn't give it. Okay. All right. Any questions on this one? All right. So the next one that we're going to go to is going to be example 2. Okay. So example 2 is asking us, and that's on page 613, y'all. So it tells us that we have an order for 700 milligrams IV acetaminophen, Q, 6 hours for pain for a child who weighs, so we have a weight of 94.6 pounds. And anytime it's in pounds, y'all, I'll go ahead and draw me a line and write kilogram, because I know I'm going to have to convert that to kilograms. Okay. And then it tells us that the recommended dose for a patient weighing less than 50 kilograms is going to be 15. So the safe range is 15 milligrams per kilogram per dose Q 6 hours, or 12.5 milligrams per kilogram per dose Q 4 hours. Lord, this one's got a ton of stuff. Okay, and then it gives us a max of 75 milligrams per kilogram per 24 hours. All right. So what we got to look at here is a couple different things. We got this safe range. We got this safe range. And then we have our max in 24 hours. Okay. Now, for this problem, which one do y'all think we should use? Should we use the 15 milligrams per kilogram, or should we use the 12.5 milligrams per kilogram? All right. So we're going to use the first one. And why? We're using the first one because our order is Q 6 hours. Okay. So I want to use the safe dose range that's going to be similar or exactly to what my doctor's order is for. Okay. So once I determine that I need that one, I can just get this out of the way, right? Because I don't even need that anymore. Okay. Because all I'm working with is this Q 6 hours. Okay. So now what's the first thing I need to do? Do I need to determine my kilograms? And how am I going to do that? I'm going to divide, right? So 94.6 divided by 2.2 is what? Let's see. 6 divided by 2.2. All right. Hopefully everybody got 43. Okay. All right. So we got 43 kilograms. So now remember what we did last time. Oh, actually, let me do one thing here. Every time I write out my information here, y'all, if it's going to be pounds, I write my line and do kilograms. The other thing that I do is when I write the frequency here, Q 6 hours, I go ahead and write that this is 4 doses. And that's going to become important later. Okay. So I cross out my Q6 and I write 4 doses. Okay. Why is it 4 doses?
Because it's 24 hours.
24 hours in a day and divide that by 6.
Okay. So if we're doing it every 6 hours, we got 4 6 hours in a day, right? So that's going to be 4 doses. Okay. So now I need to multiply my kilograms by my safe dose. Okay. So I have 43 times 15, and it's going to give me 645 milligrams per kilogram per dose. All right. So my question is this a safe dose?
No,
No.
Why?
less than 700.
All right. So my order is 700. So my order is higher than the safe dose. Okay. Or the safe dose is less than, same thing, just saying it a different way, right? So the dose that my doctor wants to give my patient is higher than the safe dose, then it is not safe. Okay. So what would I do? I'd not give it, and I would call the doctor, right? And get a clarification on that order. Does that make sense?
Yes.
Yes.
All right. So now this max right here, we're going to talk about that. Let me just show you what we would do with this max on some other questions. Okay. So how do I determine the max for 24 hours? Okay. So if I have 75 milligrams per kilogram per 24 hours, what am I going to multiply this 75 times?
The 4 doses.
Not the 4 doses, but we're getting to that point. But I need to find out how much that's going to be first, right? So it's 75 milligrams per kilogram. How many kilograms is my patient? 43. Okay. So I would multiply this times 43. And I would get 32.25 per milligrams per 24 hours. So to be safe, for this patient to be in the safe range, they cannot have more than 3,225 milligrams of the Tylenol in the 24 hours. Okay. Now, if the patient is ordered 700 and they're getting 4 doses, how much is that going to be?
2,800.
2,800. Okay. So this is saying that this patient can have max this in 24 hours. Is he okay for that 24-hour mark?
Yes.
Yes. Okay. Because when we're talking about the max that they can have, as long as they're below that max or up to it, they're okay. Does that make sense? So because he's 2,800, he's not over that max limit. So this would be okay. Does that make sense for 24 hours?
Yes.
Everybody else is good? All right. I can't see nobody, so I can't see head shaking. I can only see Kenya. I see
Yes,
Kenya's
ma'am.
head going. All right, but all right. All right. So let's move on to the next one. All right. So let's move on to number okay. Number 3 on page 614. Okay. So we're just gonna go down to clear whiteboard. All right, so this one is the same, but a little different because we're going to have a range. Okay. So on this one, a doctor ordered 15 milligrams Q4 hours. Okay. So if it's Q4 hours, how many doses can they have in 24 hours?
6.
6. Okay. Okay. So I don't need this, and I got 6 doses. All right. The weight of our patient is 38 pounds. So I automatically draw my line here because I know I'm going to have to convert. Then it says that our safe range is 0.5 to 1 milligram per kilogram per dose Q4 hours. All right, so one thing I want y'all to look at is when we did these whoops, that's not what I was trying to do. When we did these up here, right, the first one. Oh, here we go. No, this one. Oh, wait, no, that's okay. I was thinking something else. We're good. Okay, let me go back here. All right. So what we're going to have to do first is what? We got to convert our pounds to kilograms. Okay, so we're going to take our 38, divide it by 2.2, and we get 17.27. So what is that going to round to? 17.3. Okay, because our 7 is above 5. So we're going to increase that 2 by 1. So now, since I got my kilograms, to find out my safe range, I got to multiply both of these by 17.3. Okay, so this one, we're multiplying it times 1, it's going to be 13 milligrams per dose. And then this one is going to be 17. All right. Oh, 0.5 times 17. All right, we got 8.65. So this is telling us that it's Q4 hours, right? So for every dose, Q4 hours, which is what they have this ordered up here, right? We have 15 milligrams that patient can have every 4 hours. Does 15 fall in between 8.65 and 17?
Yes.
Yes.
So it is safe. Now, if it fell again below or above, would it be safe?
No.
No. Now, in the real world, sometimes you may give a medicine that's on the lower end. Okay. Why would be some reasons that the doctor may have to give a lower dose than what the recommended safe range is? What if they have kidney problems? What if they have liver function problems? Can they have as high as a dosage if their liver or kidney's not working, depending on the drug?
No.
They won't be excreted out in toxicity.
Correct. So they would be at risk for that. But for test purposes, for NCLEX purposes, for HESI purposes, if it's less, then we would not give it. It would not be safe. Okay. Because think about it because sometimes some teachers will say, if it's less, then it's safe, but it's not therapeutic. But this is the thing, y'all. You got to think of it this way. Let's say the patient is getting an antibiotic, okay, and it's less than the recommended range. It may not kill that bacteria, right? Or that bacteria might become resistant to that patient's bacteria. So in the long run, is it safe? No, because it's not doing what it needs to do. Does that make sense?
Yes.
Okay. All right. So let's do another one. All right. Any questions on this one? So yeah, so this is the thing. I'm not doing the find the dosage. So what's going to happen? All of this right here that we just did, this is just to tell us, is this order safe for your patient? You're going to still have to figure out what would be the amount that you would give the patient. Okay, but that's from pharmacology and y'all have had clinical calculate, y'all have had all that, right? So what we're gonna focus on right now is, well, you know what, let's just do that, because that way it'll be a review. Okay, so on this one, our order was 15. The available is, let's see, our available is 50 milliliters. No, wait, I'm sorry, 50 milligrams. That's a milligram per milliliter, right? So how many meals would we give this patient? Okay, so dose over half times volume. So my dose is 15. My available is 50. And my vehicle is 1 meal. These are gonna cancel. And then we got 15 divided by 50 is gonna be 0.3 times 1 meal equals 0.3 milliliters. Does that make sense? So for this question on, like if it was on the exam, they would ask you, first of all, what is the patient's weight, okay, in kilograms, which was
Can you
7.
mute?
Uh,
I was about to ask a question.
uh, so,
I'm sorry.
okay, who had the question? Sorry.
I was gonna ask you, where did you get the 50 milligrams from in the
Me
problem?
too.
So in the book, so on this problem in the book, it's telling me this is what's available. So if you're following along in the book on page 615, they give us a label for the hydralazine. That was what was ordered for this patient. And on that label, it tells us that it comes in the 50 milligrams per meal. So that's where I got that from. That is that answer your
Yes,
question?
ma'am. What page is the label on?
615. And I have the paperback book, so it might be 614 or 616 if you're in the computer.
No, I'm looking at the book. I'm on the book.
Okay.
In the book.
So we were doing the problem that we did was example 3 on page 614. And then as you get to step 4, that's where the label is. Yeah, see it. All right, so any questions on this one? So on the exam, so the things that it's going to ask you on the exam, let me go back to that real quick. It's going to ask you for the weight in kilograms, which is going to be this. It's going to ask you for the safe range, which would be this. It's going to ask you, is it safe or not, which is that. And then it's going to ask you how much you would give the patient if it was safe. So for the PEDS, usually there's 2 PEDS questions on the calculations exams. Wait, what mod are y'all in? Y'all going from 3rd to 4th? So
Yes,
it's either gonna be 1 or 2. It's gonna depend on what test they pull. Okay, so it'll either be 1 or 2, and each of these answers count as a different answer. So like this question would be worth 4. Like it would be 4 answers in one versus just 1 answer. Does that make sense what I'm trying to say?
Yes.
So it's not an all or none. So it's either you can get partial credit, I guess is what I'm trying to say for that one. All right, so let's move on to, let's look at page 816, and we're gonna do, wait, actually it starts on page 615. It's example 4. It's right under the one that we just got finished doing. And it says that we're calculating daily doses on this one. Okay. So, all right. All right, so on this one, it tells us that our patient's getting gentamicin, 50 milligrams every 8 hours. So 50 milligrams, Q 8 hours, which equals how many doses?
3.
Okay, so we got 3 doses. Okay, and our child weighs 40 pounds. So we're gonna have to convert that to kilograms. Then our safe dose range is 75. No, wait, I'm sorry. 7.5, y'all. That's a 7.5 milligrams per kilogram per 24 hours divided into 8 dose. Oh, wait. Excuse me. Divided into Q 8 hours. Eight hours. All right, so what's the first thing I need to do on this one?
Divide 40 by 2.2.
Okay. All righty, and we got 18.18. So what would my final weight be?
18.2.
Okay. All right, so now since I have that 18.2, to see what my dose range is for 24 hours, what do I need to do with that 18.2? I got to multiply it times that 7.5 milligrams. Okay. All right, so we got 136.5 milligrams per 24 hours. Okay, in divided 8-hour doses. All right, so 2 different ways you could do this. Okay, one way is I'm gonna show y'all how I do it. Okay, I'm just gonna show you how I do it. All right, but just I do know that there's 2 different ways. Okay, so the way that I do it, so what I'm gonna do now is I'm gonna take, because this right here says in 24 hours, right? So in 24 hours, if my patient is getting 3 doses of 50 milligrams, we'd have to multiply this times 3, and 3 times 50 is 150 milligrams. So this is how much this patient would be getting in 24 hours. Okay. Is that 136.5?
No,
It's above it, right? So is it safe?
no.
No.
Ms. Sanchez,
Uh-huh.
you lost me at
Okay.
the 3 part. Where did the 3 come from again?
So the 3, let me change my color here so we can do that. The 3 is going to be because our patient's getting it every 8 hours.
Okay,
That's 3 doses
okay,
in that 24 hours.
all right.
And the reason why, y'all, that I always, when I write this out, I go ahead and write my doses, because what I end up doing and what y'all end up doing is when we're looking at figuring it out for the 24 hours, y'all end up multiplying it times 8. Y'all see it, oh, it's it's Q8, okay, times 8. But in reality, it's 3 doses, because it's every 8 hours. Does that make sense? So y'all, the other way you can do it is you can take this 136, divide it by the 3 doses, because it says every 8 hours right here. So that would be 3 doses. And we would get we would get 45.5. Okay, so the second way you could do it, okay, so you can just make it for the whole day, or you can divide it, and this is going to be per dose. So again, is it safe if our dose is 50? Our dose is greater than this, so is it safe? No. So either way is correct, y'all. Whether you divide this by 3 and get the dose, or whether you multiply this times 3 and get the whole day, it's still going to come out to be the same. Right. Any questions on that one?
So for it to be safe, it would have to be more than 50 or more? Or
I'm sorry,
no?
what was the question?
So for the answer to be a safe dose, it would have to be 50?
Actually, for this one to be safe, it would either have to be this right here would have to be 150, or this right here would have to be 50. So it would have to be this exact thing, since it's not giving us a range, it's only giving us one number. It would have to equal to that exact order for it to be safe. Does that make sense, Kenya? Yeah, okay. All right, any other questions on this one? All right, so let's look at we did that one. All right, I'm supposed to sit anymore. All right, so what I'm going to do now is I'm going to put one up here, and I'm going to give y'all a couple minutes to work it. Okay, see how far you can get. Okay, and then we'll work it together. Okay, and then as you get your answer, just again put it in the chat just directly to me and not to the whole class. Okay. All right, so we're going to do. All right, so we got an order. All right, so we have an order for 125 milligrams Q, 6 hours. Okay. We have our weight. It's going to be 36 pounds. All right, we have the recommended safe range of 25 to 75 milligrams per kilogram per day, divided in 6 to 8 hours. All right, and then our available is 250. 250 milligrams per 5 meals. All right, so I want y'all to figure out the kilograms. Okay, safe dose range. I want you to tell me, is it safe? And if it is, how much would you give? All right. Hmm. Mhm. Mhm. Okay, so I'm seeing some answers come across. So I want to say something without giving the answer away. Okay, so one thing I just want to make sure that you're looking at, okay, is that this right here is for the whole day. Okay, so in order to check for the safe range, this would have to be multiplied by your doses for the day. Okay, how many doses would that be? Alrighty, let's see. I'm getting some. Alright, so we got that. Okay. Alright, so one other thing I want to say is just don't forget that when we're, oops, when we're figuring that amount for the day, we're not multiplying it by 6 hours, but we're doing it by the dosage. Okay, so remember we have 4 doses if it's every 6 hours. Okay. Is anybody else working on it? Are y'all ready to go over it? There we go. All right. Okay. All right, so let's go ahead. I have quite a few of y'all that answered. And for the most part, everybody's on the right direction, but there's a few just little minor things, and that's the kind of the things that I was pointing out here. Okay. All right, so first, what is our weight? So 36 divided by 2.2 is what? Let's see.
16.4.
16.36, which would be 16.4.
Okay, so we have our 16.4. Okay. And then once I get that kilogram, what do I got to do? I got to multiply it by both of these, right?
Safe doses.
Okay. Times 16.4. All right. So we're going to have times 25. So we got 410. And we had all right, 1230. All right, so we have 410 milligrams to 1230 milligrams per day. Okay. So this right here we have, so this is our safe range right here. Okay. So to find out if it's safe, because this is for a full day, we have to multiply our order that our patient's getting times the doses. So if it's every 6 hours, that means they're getting 4 doses. And 4 times 125 is 500 milligrams. So does 500 fall in between our range? Yes. So it is safe. Okay, does that make sense so far? If not, if you don't want to say it out loud, you can say something just in the chat and I can explain it a little better. And then the last thing is just, if it's safe, how much am I going to give, right? So we've determined all of this determines that it is safe. So now we're going to do our dose over half times vehicle. So our dose is 125. Our on hand is 250. and our vehicle is 5. So 125 divided by 250. Oops, wait, I did something wrong. Hold on a second. Try this again. 125 divided by 250 is a half. And then when we multiply that times 5, we get 2.5 milliliters. So did anybody get lost anywhere or need me to go over any area in more detail or?
Okay, Miss Sanchez,
Okay.
so I, okay, I converted to the 16.4 kilograms and I
Okay,
divided each one, I did it times 25 and I did it times 75 to get the safe dose range from there.
okay.
Only thing I'm forgetting is the next step after, so which is the entire problem. So I
Right.
just, you know,
And this is the thing, whenever you're first looking at your problem, sometimes it may say for your safe range, sometimes it may say day, okay, which means we would have to multiply at times the dosage, right? But if this just said per dose, would our patient be in the safe range? So if it says 410 to 1230 per dose, my dose is 125. Would have this been safe if it said per dose?
no, it
No.
would have been
No.
too high.
It would have been too high. So one other thing that you got to really look out for is, does this say per day or per 24 hours? It may say per 24 hours or per day. It's the same thing, right? It's just a different way of saying it. And or it may say per dose. Okay. So you
That's what
have to
I'm
be,
being messed up on.
yeah, you got to make sure that you're pulling that out and saying, okay, is it asking me for the whole day? Or is it just asking me per dose? Because that's going to make or break your answer, right? I mean, it's gonna make a big difference with if your answer is right or wrong, because you may have to multiply this times those doses if it's for the 24 hours. Okay. And kind of like we've said all along with the math, you just have to do the practice, right? The more practice you do, the more it becomes second nature. So if you're kind of writing down steps, like the first thing that you'd want to do is when you want to write it down, everything from in your problem. And like I said earlier, as soon as I write this out, I go ahead and I write my doses. Okay. Because if not, I can guarantee you, if I didn't write this, I would have multiplied this times 6. Okay. Because you're looking at it and you're like, oh, it's 6, not thinking that's every 6 hours. Okay. Then you're going to convert your weight. And then when you find that safe range, you got to make sure that you look at, is it asking me for day or dose? Okay. And then see where you fall. If it's for the day, we got to multiply each dose times how many doses to see if it falls in there. So it's multiple steps, but they're not hard steps. Like they're not complicated once you kind of get the hang of it. If you do if you're doing multiple problems and you're doing the practice problems, it will make sense. Now, I met with somebody the other day, I don't remember who it was, but she was looking at this with Nurse Sarah. And I usually like Nurse Sarah. I mean, she's really good. A lot of people like her. But I didn't like the way she taught this. Like she did it. I feel like it was more complicated. So if you do watch some people online, just be mindful that, everybody's going to do it a little different. You can still get to the same answer, but just be mindful that it may be, some people are not going to teach it the same. It may be a little bit more difficult depending on who you're looking at. All right, so let's do this. Does everybody have their book? I'll tell you what I'm going to do. I'm going to, All right, I'm gonna stop sharing this for a moment. And I'm gonna share my book page. And then we're gonna do one out of the book. Let's see. Share. Nope, that's not it. Give me 1 second. All right, this is chapter 24. And this is page. Let's do. All right, so. 620. All right, y'all, so let's do this problem right here. Let's see. What I was trying to do. All right, so what we're gonna do, let me share this page now. All right, so but I want can everybody see my page? It's gonna be a label on there for a cephalosporin. All right, so what I want everybody to do is let me fix this to where I can get this in there without it. Okay, so go ahead up here, get this information. So we have our child weighs 35 pounds. And he has an order for the K-Flex 150 milligrams PO every 6 hours. Once everybody gets that information about the child's weight in the K-Flex order, then I'm gonna scroll it down to where you can see everything else that you need. All right, so we got the weight of 35 pounds, and then the order is the 150 Q 6 hours. All right, so next, this is the answer, the questions that we're going to answer. So this is kind of how it's going to be on the test. So it says, what is the recommended dose in milligrams per kilograms? It's going to ask us, what is the child's weight in the kilograms? What is the safe dose range? Is the safe dose ordered? And if so, how much? Now, on your safe, where is the safe dose range? Give me 1 second.
Is it that
It's in
25
that
to
small
50
writing,
milligrams per kilogram a day?
So it's in here.
Yeah, look right
Yes.
under the usual where it says usual pediatric dose, under the 250 milligrams per 5 mil.
Oh, okay, I see it. Okay. So can everybody see that? So the usual pediatric dose, which is your recommended safe dose range, is going to be 25 milligrams to 50 milligrams per kilogram per day in 4 divided doses. All right, so I'm going to give y'all a moment or two to work this problem. So this is kind of how it's going to be on the test. Okay. You're going to have the order with the weight, and then you're going to have to answer, all of these questions. Now, I don't think on any of the calculations exams that I've seen that's got the pediatrics, none of them have an actual label. Like all the information would just be given to you, and you would have to figure out what to do with it. Okay. All right, y'all ready to work it together? Or does anybody need another minute or two? I've seen quite a few people put their answers in the chat. All right, so I'm just gonna work it on this page, just so we have everything there. So the first thing it says, what is the recommended dosage in milligrams per kilogram per day? What is our child's weight? Okay, so our weight we said was 35 pounds. So 35 divided by 2.2 is 15.9. Is that what everybody got? So we got
Yes.
15.9. All right, and then it wants to know if the dose is what is the safe range? Okay, so we had 25 to 50 milligrams per kilogram per day. So now we got to take off 15.9 kilograms, multiply it times each side. All right, and we are going to get okay, times 25. So we got 397.5 to 795 milligrams per day. All right, is everybody good so far? Okay, so this would be the answer for C. Okay, then it says, let's see. Is the dose ordered safe? Okay, so our order was, sorry, let me see what our order was. Our order was 150 milligrams Q6 hours. Okay, so how many doses did that equal? That's going to be 4. All right, so our 4 doses. So since this is per day, we got to multiply this times 4 because that's how many doses the patient's getting in a day. And that's going to equal, is that 600, y'all?
Yeah.
Yes.
So our patient is getting 600. So does that 600 milligram fall in between our range?
Yes.
Okay, so we are safe. Okay, and then this is going to be part D. Okay, and this is going to be D. All right, and then how do we find our milliliters that we're going to give? Okay, so our dose was 150, excuse me, our order was 150. We had available 250 per 5 meals. All right, so I have my order divided by my available times my meals. Let's see. Times 5 should be 3 meals. Okay, is that what y'all got?
Yes.
All right, this would be E. All right, and then I'm not sure on A exactly what they're asking. What is this? So we got the safe dose range, which was C. What is the recommended dosage in milligrams per kilograms per day? I'm not sure. Hold on a
Is
second.
it that 25 to 50 that's on the label?
Yeah, that's what I.
Is that what they're,
That's the only thing I can see.
yeah, because I'm gonna actually look at the answer in the book because I'm not sure if that's what they're asking. What is the recommended? I guess that would be, yeah, I guess that would be the recommended dose, huh? So that's what they're recommending per kilogram per day. All right, let me just make sure on the answers, because I really wasn't sure on that one. Let's see that. Answers on page 646. 21. Yep, y'all are right. So it's asking us about what this right here is. Okay, so that 25 to 50 milligrams per kilogram per day. All right, so this would be a typical question, how it would be set up on the exam. The only thing would be is that they would not have the label. It would just give you like the information that you needed to be able to work it out and figure it out. So did anybody get lost anywhere on, I saw somebody said they had gotten lost on what to do when they got to C. I think, whoops, that's not what I wanted. When they got to C, let me see exactly. Let's see. Answers on C. Okay. So the C, so question was is just how to know, like once you find that safe dose range on C, then what measurements to use from there. So because this is per day, the measurements that we would use from that point would be taking that 150 milligram dose, milligram per dose and multiplying it times the dose. That would give us what we would need, how to find, I guess, that if that dose range is safe after we find that. Does that make sense? Did anybody get lost at any other steps or anything that y'all need me to go over? This is pretty much, this is it, y'all. Like, this is the hardest, this would be like the hardest of it. If you could, get through this, this is pretty much it.
So basically,
Some-
pay attention to dose per day or dose and day daily,
Correct.
like for
Correct.
24 hours. Okay.
Correct. Let me see if there's one that we can do that's per dose, because every one of them we've been doing has been per day. Let's look at.
Ms.
this-
Sanchez, before we move on, the 600 milligrams, I'm sorry, y'all.
That's okay.
So
Right here.
how is this, how do we know that this is the safe dose?
So what's going to happen is, because this is a couple things, let me change my color so I can all right. So when we got our safe range, okay, that right here, it's telling us that this is the safe range for that whole day.
Okay, I got it. Thank you so much. Okay, I'm
Okay.
sorry. I didn't pay attention to C, yes.
That's
Because
okay.
I'm just focused on the 397.5. Okay, I'm seeing. Thank you.
Yes. So now you see, so once you say per day, then we have to multiply it times those 4 doses to give us that whole day amount. Okay. All right. Let me see if I can find one that's per dose versus per day. Second, just so y'all can see kind of the difference with that. Let's see. Hmm. Y'all, you don't have to worry about the BSA formula and stuff like that. We don't make y'all learn that. If you work in peds and you need the BSA and all of that, there's conversion calculations and stuff to do all that. We don't do all that by hand. Let's see. Well, I don't even see any per dose per day. Everything's per day. Okay. Well, I don't even see any per day, y'all. So let's see. Check a couple more. These are daily. Oh, well, I don't even see any per, per dose, y'all, so, let's see, yeah. Let's see. For 24 hours, so all of these are per 24 hours. Oh, wait, here we go. All right, let's do this one, okay. Let's look at page 645. All right, let me get out of here. Oops. Oh, wait, I'm gonna delete. Ah, crap. All right. All right, so let's go to page 645. Okay, so it's gonna be question 36. 34. All right, so this one right here, y'all, number 36. All right, so it says acetaminophen 525 milligrams IV Q4 hours is ordered for a child weighing 92.4 pounds. The dosage for a child ages 2 to 12 or adolescents weighing less than 50 is 15 milligrams per kilogram per dose every 6 hours, or 12.5 milligrams per kilogram per dose Q4 hours, up to that maximum of 75 milligrams a day. All right, so this one's asking us, what is the safe dose range for this child? All right, so I'm going to give y'all a moment to work it, and then we're going to work it together. Okay, and we're doing this one, right? Oh, crap. There it goes. We're doing this one. Y'all need me to expand it a little bit, or is it big? Can y'all see it?
I can see it.
Y'all can see it, okay.
Ms. Sanchez?
And y'all got me talking this whole time. Nobody said nothing about it being on mute. Did y'all hear any? See, I
I
didn't hear
was,
that.
I
We
was
ain't
saying
heard
something,
nothing.
you shouldn't answer.
See, I didn't hear nothing I just said.
No. Crazy.
No. Oh God. Okay. So from so from what I wrote on here, let me just go over it real quick. All right. So our order, okay, is the 525 every 4 hours. Okay. We have our weight of the 92.4. We converted that to 42. Okay. Now they gave us two dose ranges here. Okay. Now, we're going to use the one that is most closely related to what our order is. Okay, so this order was every 4 hours. So I want to use the recommended range for that Q4. Okay, I don't have to do anything with this other one. Okay, so this one, that's the 50 kilograms. We don't have to do anything with that because it's for Q6 hours, okay? And since our order's for Q4, we're going to use this one because it's Q4, okay? So then this is our Q4 hour range. We're going to multiply it by kilograms. And this is what we get that's safe for this patient per dose, okay? Now, when I look at what was ordered, it's the same thing, right? 525 milligrams. So it is safe. Does that make sense? Did anybody get lost anywhere on here? So even though it didn't ask us for the weight in kilograms, even though it didn't ask us for these multiple different things that it normally asks and that we have to do, we still had to convert to kilograms, right? Even though it didn't ask us, because if we didn't convert it, could we get that safe range? No. Okay. So there's still some steps in there that we had to do that they didn't necessarily ask us for that answer, but if we didn't do it, we wouldn't be able to get the correct answer. Okay. So did anybody get lost on here?
I did.
Okay.
I got lost because I was actually doing both of them, not really paying attention to the Q4 hours.
Okay.
But I understand it now that you've
Now,
explained.
okay. Yeah, and see, when we look too at this, it tells us or, that either or. So, and again, it's just getting used to how this is written, right? It can be one or the other, and we want to use the one that's most closely related. So really the only time that you would kind of have that range where you're doing both of them, well, not both of these, but like that range would be where it would say like 12.5 milligrams to 30 milligrams. It would have that range in that one little recommendation. Does that make sense? You'd never have two separate ones that you would be working both of them. It would be, if it's a range, it would be, 15 to 30 or whatever it's going to be per kilogram, milligrams per kilogram per dose or day. Okay. Did anybody else get lost or not know, like, okay, which one of these should I use? So let me get y'all to do this. So on this one, it tells you your patient can have a max of 75 milligrams per kilogram per 24 hours. So how would you figure out your patient's max? For this patient, if they're telling us this is the maximum this patient can have, how do you know, how would you figure out the maximum milligrams per day? So if it says the max, okay, is 75 milligrams per kilogram per 24 hours. So for this patient, how would we know if the 6 doses that she's getting falls into this max? So what do I have to do with this first? If it's 75 milligrams per kilogram, how many how many kilograms does your patient weigh?
42.
So I gotta multiply this times 42. Okay, and that's gonna give me the max amount of Tylenol that this patient can have a day. 75 times 42 is 3150 milligrams per 24 hours. Now, for your patient, how much are they getting? They're getting 525 milligrams. How many doses are they getting? If it's Q4, how many doses is that?
6.
6. Okay. So what I need to see, what I'm trying to find out is if this patient gets this every 4 hours around the clock, are they going to fall within this max? Okay. So they're getting 525 times 6 doses. How much is that going to give me?
3150.
All right. So am I safe?
Yes.
Okay. Does that make sense?
Yes.
Because the thing is you have to know that max for the day, right? Because what are we dealing with right here? We're dealing with Tylenol, right? Acetaminophen. And what can that do is if we're above what's our max, what they're saying our max a day should be.
The 3150?
Well, just in general for Tylenol, anybody who takes Tylenol, what's the max number that you
Oh,
should?
4,000.
There you go. So 4,000. Okay. So 4,000 is the max that anybody can have, what they recommend anybody can have a day, right? So because it can cause that liver damage. So 4,000 is the max for anybody, but for this patient, the max is 3,150. Does that make sense? Because anybody who's on Tylenol, any patient that you're taking care of that's got, let's say they're taking multiple things with Tylenol in it, you have to be able to figure out for every drug that's got the Tylenol in it, how much are they getting and add it up for the day to make sure they're not going over their max. All right, y'all want to do any more practice or y'all want to do some practice on your own and then we look at it again?
One on our own.
Okay. All right. Because until you sit down and start doing them on your own, are you going to really know if you understand it? No. All right. Well, I will upload this video as soon as it gets, as soon as it uploads to the cloud. 1 second, let me do all this. All right. All right. So once this finishes,